Welcome to everyone. My name is Hugh Kim. I'm the director of the Center for Blood Research, and I'm very pleased to welcome everyone to our event in honor of a terrific scientist, Dr. Michael John Page, who tragically passed away in 2013, which was the year that I actually joined the CBR as a faculty member. So I never had the honor of meeting Mike, but I do have the honor now of saying a few words in honor of this event. So I'll say a few words just to recap some of this history that was generously provided to me by Dr. Ross McGilvery, who unfortunately couldn't be with us today. But Michael's education started with his high school graduation from Port Arthur Collegiate in Thunder Bay in 1994. Followed that up with a Bachelor of Science degree in biochemistry from Carleton University, and 6 years later, earned his PhD degree under the supervision of the aforementioned Dr. Ross McGilvery here at UBC. So there are three major aspects that I'd like to point out just with in relation to Mike. And the first is his impressive record of academic achievements. So while in Ross's lab, Mike published 5 papers from his study, 4 as first author. In addition to his publications, he received competitive salary support from the Canadian Blood Services. The second thing I wanted to touch on is his enthusiasm for training others. So the example I was given here is Mark Bleakley, who was a graduate student by day, but also worked to keep unsavory characters out of certain establishments by night. And he's an individual who is an example for someone who was trained by Mike, maybe not only in the sciences. But Mark is currently a research scientist in Melbourne, Australia. Now, the second thing I wanted to touch on is, or the third thing rather, is the idea of work-life balance that was espoused by Mike. So we have pictures here that document a clear affinity for beer and hockey. So these are two subjects that many Canadians can identify with. But that aside, coming back to his academic accomplishments, after graduating from UBC, Mike undertook a postdoctoral fellowship under the supervision of Enrico Di Serra in St. Louis. And the attestation from his postdoc supervisors that Mike co-authored 10 papers between 2005 and 2009. He was first author on 8 of them. But the praise that strikes, that's very striking here, is that this was some of the best work ever done from my lab. And, quote, I will miss his ingenuity, deep knowledge, and enthusiasm for science. So clearly that the training he received from Ross ended up becoming amplified greatly during his postdoc. So following his postdoc, Mike took a junior faculty position at UC San Francisco, mentored by Charlie Craig. So while there, Mike worked on restricted interaction peptides that work to deposit fluorescent or nuclear imaging signals at cell membranes. Now, this work resulted in a US patent as well as a spin-off company. So clearly Mike's was absolutely on his way to a wonderfully productive scientific career. So in honor of Mike's life, his father, Roger Page, set up a endowment in conjunction with the Center for Blood Research and the Department of Biochemistry and Molecular Biology, which is used to support an award that is given every year to a postdoc who best exemplifies the values and the spirit reflected from Mike's academic career and extracurricular accomplishments. So for this year, the winner is Mohosin Rana from Jay Kazakadatu's lab, who will speak to us today on engineering immunity, empowering people, advancing transplant tolerance, and building scientific communities. Congratulations, this is well deserved.
Good afternoon, everyone. Thank you so much. It's a great honor to be here as a recipient of Michael John Page Postdoctoral Research Fellow Award. I'm truly humble and honored to receive this award. And also, I'd like to thank CBR and Department of Biochemistry and Molecular Biology to give me this opportunity to share my journey as a researcher, as well as a contributor of a building community, which I entitled as Engineering Immunity, Empowering People, Advancing Transplant Tolerance, and Building Scientific Communities. As already Dr. Hugh Kim introduced me, so I'm Mohosin Rana, postdoctoral research fellow, as well as Michael Smith, a health research trainee at the Department of Pathology and Laboratory Medicine, as well as Center for Blood Research. And before starting my presentation, I'd like to acknowledge that this presentation takes place on the traditional, ancestral, and unceded territory of the Musqueam people, on which the University of British Columbia is situated. Okay, a tribute to Dr. Michael John Page, an excellent scientist and innovator, as well as community builder. As already Dr. Hugh Kim talked much about him. So I'd like to just go with some snapshots of his achievements. So he did his PhD in 2004 from UBC, and then he joined as a junior faculty at the University of California, San Francisco. He's one of the pioneer of peptide-based probes to detect blood clots, and also co-founded BioPaint Incorporation. And also he's the creator of the CBR website, as well as hosted annual biochemistry hockey tournament. And his friends and family remembered him as a glue to bring everyone together. And I believe that Mike had an endless excitement and drive for science, sports, and life. And he shared that passion with everyone around him. So, today, I'm going to share my journey in 5 parts. First, clinical challenge about transplantation and rejection. That's the research work that I'm doing here at UBC. And I'll talk briefly about the scientific innovation that I'm doing. And beyond lab, I'll talk about my mentorship and community building activities, which resonates with Mike Page legacy. And finally, closing remarks with acknowledgements. So let's jump into some numbers of organ transplantations. So from this first image, you can see these are the numbers just from the US in 2023. You can see, like, as of 2023, almost more than 42,000 organ transplantation has been done in US, which is a record-breaking number. And among them, like, the significant number of organ transplantation was done in kidney. So, and interestingly, since as of 2023, more than 1 million organ transplantation has been done just only in US. And as of in 2022, more than 100,000 people are on the waiting list for organ transplantation. So how how significant these issues, clinical issues in US, that could be seen from this number. And if we look at these numbers worldwide, so 2 major organ transplantation, kidney and liver, you can see that American region is dominating in both cases. So, and this actually, these statistics is also included Canada and US in the numbers.
I just do a couple of taps on it. Just tap it gently. Don't hold it, just tap. It went over.
Okay. Anyway, so in this slide, you can see the amount of costs.
Let's see that one.
Okay. Okay, sorry for the interruption. Yeah, so from this figure, you can see like those who go through this organ transplantation, they also have this experience of socioeconomic burdens. Both those who have a successful organ transplantation as well as those who are got a graft failure after transplantation. And from this figure, you can see like it becomes more worse for those people who experience graft failure after transplantation. So in terms of socioeconomic impact, it's a nightmare for the people, patients and their families. And one of the significant rejection consideration is the acute rejection. So although there are some clinical advances are there, but still people are struggling to figure out the solution for this clinic. Okay, no worries. Yep. Yeah, I off.
No. Unstable network connection.
This is audience mix.
Sorry for the interruption. If anybody knows any song or dance routine that they'd like to entertain us with for the next 2 minutes while we get the idea, that'd be great.
Yeah.
I guess in the meantime, I think.
Okay. Okay, sorry for the interruption. All right, so as I mentioned, like there is a big clinical challenge in this field of organ transplantation and the rejection. So people are looking for numerous scientific innovation, and to contribute in that adventure, actually we also are looking for a solution. And in our case, we focused on glycoengineering. So it's a like type of cell surface engineering to try to resolve this acute rejection acute rejection of the organ transplantation. And I would like to first talk a little about the scientific background behind this strategy. So if you can see the anatomy of vascular endothelial wall, the healthy one, it has a protective endothelial glycocalyx layer, which is composed of sugar and glycoproteins, and it protects the endothelial wall from immune cell activation and subsequent events. But what actually happens during organ transplantation or after organ transplantation? So this protective layer get damaged due to oxygen deficiency as well as ischemia reperfusion injury or IRI. And due to this damage of the protective layer, immune cells come into attack and they trigger different immune activation cascades followed by inflammation and with the ultimate result of graft rejection. So if we can see that, if we look at the timeline of the organ transplantation, so the acute rejection, which is about 40% in case of graft failure. So the acute rejection phase starts right after organ transplantation due to the infiltration of T cell attack. And if it remains untreated, it triggers chronic rejection by infiltrating macrophages that comes into attack and triggers chronic rejection. And if the situation remains untreated, it just gives the ultimate result of graft failure. So we asked a simple question: can we re-engineer the cell surface to communicate with the immune system and mimic the whole damaged glycocalyx layer to prevent the immune cells to attack the graft? So based on our question, we hypothesized that if we can remodel this glycocalyx by designing a glycoconjugate composed of peptide linker, simple polymer backbone, and immunomodulatory sugar part, then we could remodel that damaged glycocalyx by cell surface engineering. And as a result, we can inhibit the immune cell activation as well as extend graft survival. So based on our hypothesis, we designed and developed this glycoconjugate. You can see it has three components: the immunomodulatory glycan part, which is sialic acid, a major component of glycocalyx, and a linear polyglycerol backbone to hold the structure of the glycoconjugate, and a Q-tag peptide linker to anchor this conjugate onto the damaged cell surface. After synthesis, we have gone through a vigorous chemical characterization, including FTIR and proton NMR, to confirm the synthesis of this glycoconjugate. After synthesizing this glycoconjugate, now question comes whether this glycoconjugate has the ability to attach on the cell surface to mimic and remodel glycocalyx. So to validate this, we performed ammonia generation assay. So how it works. So if the attachment happens perfectly, this attachment is actually done by transamidation reaction between the glycoconjugate and the cell surface protein. And this transamidation reaction is done with the help of transglutaminase enzyme, and it forms isopeptide bond between the glycoconjugate and the cell surface. And as a byproduct of this reaction, ammonia generated, and we quantified that ammonia through ammonia generation assay. And from the figure, you can see our glycoconjugate successfully attached on the cell surface, which can be seen by the amount of ammonia generated after cell surface conjugation attachment. And then the question comes after attachment, whether this glycoconjugate protects the endothelia or not. To confirm this, we have performed a PBMC-mediated cytotoxicity assay. And in this case, we have also checked whether there is any dose effect on the protection or not. So from the cytotoxicity assay, we confirmed that our glycoconjugates have done an incredible job by protecting endothelium and endothelial cells. And by increasing the dose concentration of the glycoconjugates during glycoengineering, we can significantly reduce the damage of endothelial cells. So during this immune activation phase or acute rejection phase, one of the key players are the cell surface adhesion molecules. So after the damage of the glycocalyx layer on the cell surface adhesion proteins like ICAM, VCAM, E-selectins, so they become accessible. And when they become accessible, they trigger the activation of immune cells, as well as release of pro-inflammatory cytokines. Also, they trigger the activation of complements. So after cell surface engineering or glycoengineering with our glycoconjugates, whether this accessibility of this cell surface adhesion molecules become reduced or not, we validated that by targeting ICAM accessibility. So this figure on the right, you can see the ICAM accessibility assay. And before and after glycoengineering, we can see the significant differences. So before glycoengineering with our glycoconjugates, the ICAM accessibility is pretty high. And after doing glycoengineering with our glycoconjugates, the accessibility of ICAM reduced significantly, which confirmed the camouflaging of the endothelial layer with our glycoconjugates. As I mentioned, like this cell surface adhesion molecules also triggered the activation of complement during the inflammatory stage. We also checked whether this complement activation get reduced after glycoengineering or not. So in this case, we targeted C3 complement activation pathway, and after treating endothelial cells with our glycoconjugates, we confirmed that the complement activation significantly reduced compared to the untreated one. So all this indicated that our glycoengineering with our novel glycoconjugates successfully did the endothelial protection as well as immunomodulation. Apart from these in vitro studies, we have also performed some in vivo studies, and here I'm going to show one in vivo study on mouse artery transplantation. And after 15 days of post-transplantation with our glycoconjugates treatment, we can see from the histology images as well as the quantification data that glycoconjugates preserve endothelial integrities in grafts significantly compared to the untreated one. And also it lowers CD86 expression in conventional dendritic cells, which ultimately reduce the activation of cytotoxic T cells. We have also checked the infiltration of cytotoxic T cells, and we have found that glycoengineering reduced cytotoxic T cell infiltration significantly throughout the vessel layers, including intima, media, and adventitia of the artery vessels. Also, we checked the macrophage infiltration, and we found that glycoconjugate markedly reduced macrophage infiltration compared to controls. So both in vitro and in vivo studies showed that our glycoengineering strategy worked really nice to prevent or reduce the acute rejection events. And this is the take-home notes from this glycoengineering study that you can see. Transplant rejection remains a major barrier despite clinical advances. And we designed and functionalized glycoconjugates with immunosuppressive sugar and bioactive tags to strengthen endothelial defense. And we also demonstrated the efficacy in both in vitro and in vivo, reducing immune activation and improving graft protection. And apart from transplantation applications, so this kind of strategy could be really impactful for other clinical applications like vascular injury, inflammation, and tissue engineering. Okay, so beyond the lab, all these research stuffs, I'd like to share some of my mentoring and community building activities. And it's really amazing. So my mentorship journey started when I was a PhD student back in 2018 to 2022 at the University of Calgary, where I had the chance to supervise and mentor some amazing undergraduate students. And they have a program called Pure. So it's an undergraduate summer internship program at University of Calgary. So there's a couple of my summer students. They're now doing really great in academia. One of them is doing his PhD in UC Berkeley, and one is working as a trainee in engineering. And the other one, she's doing her PhD in France. Apart from mentoring summer students, I have also engaged in a program called International Student Mentorship Program. This is a kind of unique program at University of Calgary, where they actually provide support to the new incoming international students to get adapted with the culture of Canada, as well as the academic and non-academic lifestyles at the University of Calgary. So I had a chance to mentor and help a couple of grad students, and one of them is Carolina. She came in 2021 at the University of Calgary from Columbia to pursue her master's, and I helped her, mentored her to get adapted with the culture in Canada, and particularly in Calgary at the University of Calgary. After moving here at UBC, I just keep continuing this mentorship journey. So I have officially and unofficially mentored a couple of grad and undergrad students, and the official one is Anna. So she came from Queen's University last year under CBR summer studentship program. I mentored her throughout the summer, and she did a really great job. And I'm really happy to mentor all these amazing guys. So this mentorship journey actually gave me immense pleasure when I see my students are doing great from their first research experiences to independent scientific achievements. It's amazing. And my journey still continues. So you can see this was the group of my PhD PhD institution, University of Calgary, and I worked with these amazing people, and I got lots of appreciation and positive feedbacks from my mentees, from my summer students, and I would like to share one of the appreciation that I received from one of my summer students just after coming here at UBC. So that's incredible. Also here I'm working with this amazing group and I'm still trying to help and contribute to my colleagues, my friends, my lab mates, and it's really amazing to get the reward of helping others. And sometimes it really gives you a really amazing feeling when you see the rewards coming on from your like contribution. And one of the really amazing feeling that I got when I saw my summer students, as a summer student was presenting her work on CBR Research Day. That was a great experience for me. And all these experiences actually gave me this belief that mentorship built on inclusivity, growth, and shared success in science. Apart from mentoring students in the lab, so I'm also still actively involved in building communities. So back in my PhD time at University of Calgary, I was involved in an international student organization, and a part of my role there, I was actively involved in arranging a knowledge translation program to engage immigrant communities with the university, and we have organized a couple of events as well as seminars, including 3-minute thesis to introduce immigrant communities with STEM and promote science among them. And as a part of the program, we also presented our outcome to this newcomer research network symposium in 2019 at the University of Calgary. And also, like as a part of the knowledge translation, I have filed a patent of my PhD work that is about a hybrid hydrogel scaffold development for cartilage tissue engineering application. And beyond this, I'm also involved in a couple of encyclopedia entry publications, including polymer-based embolic agents that I published back in 2022. And beyond this, I'm also actively engaged in a global outreach program to promote STEM. So I have been, I'm still an active member of American Society for Microbiology. They have a program called a Global Outreach Program to promote science to the developing countries. So I've been in this program since 2014, and we have arranged a couple of webinars in different occasions to promote science to the developing countries. And also, I have actively involved in Let's Talk Science University of Calgary chapter since my PhD time, and it was an amazing experience because I was involved in arranging a couple of STEM workshops in different elementary schools to promote STEM to school students. That's really amazing experience. So this actually gives me really a pleasing feeling that science is most powerful when it comes with connects with people. So this is something interesting, like apart from as a researcher and also a volunteer to build a community, I'm also kind of passionate about photography. So during my PhD time, I spent lots of time in photography, and one of my work has been published in a Global Research Initiative artwork book at the University of Calgary back in 2021. And beyond this, here at UBC, I'm still actively involved in different mentoring and knowledge translation activities, as well as my voluntary services to the Center for Blood Research. So I have been working as a poster judge since 2022. You can see some of the snapshots of my judging moments. So don't judge me now with the pictures. Okay. So this is a kind of like my personal opinion about the resonance with the Mike Page legacy that I'm holding, that I believe personally. So the part of my this journey built on three major factors or pillars, whatever you call. Excellence to pursue high impact research that pushes the boundaries of translational medicine. Passion that driven by curiosity and commitment to making research meaningful to a community for communities. And finally, mentorship to guide students and fellows, fostering inclusivity and building supportive scientific environment and communities. So I believe these values have shaped my journey, and they echo the legacy of Dr. Michael Page: excellence in science, passion for life, and dedication for mentorship. So looking ahead, I believe that empowering science by advancing glycopolymers toward preclinical and clinical applications through strong collaborations with transplant physicians and immunologists would give a huge impact to the community by engaging with the communities to ensure science addresses that need, real needs. And I believe integrating science, community, and patient perspectives for meaningful impact would help to empower people. Finally, closing and acknowledgement. So I'd like to acknowledge some of the outstanding people that I have met here at UBC. First of all, I'd like to give a big thanks to my PI, Jay, and an amazing group of people with whom I'm working since 2022, my lab mates. They're amazing and helped me a lot to improvise all my skills and my mentorship and all the other creativities. And also, I'd like to thank all the collaborators, Dr. Jonathan Choi from SFU, and Dr. Steve Withers and Lian Sim from the Department of Chemistry at the UBC, and also Dr. Jenny Zhang from Northwestern University. Also, I'd like to thank all our funders and supporting agencies. And with that, I would like to thank everyone. And just a quote from me to all of the audience: the true measure of science is not only in discovery, but in the people and communities it empowers. Thank you all.
Dr. Rana, thank you very much for the presentation, and congratulations again on the awards. It's richly deserved. Thank you to everyone for attending. I'd like to thank Roger Page, especially, whose endowment made this award possible as well, in addition to the Department of Biochemistry and Molecular Biology. So immediately afterwards, there's a reception in the 4th floor pod with food, and in a very